Good afternoon, and thank you for joining us this afternoon. We are here in Rockwall, Texas at the Stonebridge Veterinary Hospital with Dr. Kurt Avery and myself, Linda. I thank all of our visitors and viewers that we've had that have emailed or called us, and you have brought up another interesting subject for us at this time of the year, which is probably on a lot of people's minds right about now, and that is the allergies. And I sit outside and if I can sneak just a few minutes each day and enjoy the weather. It's absolutely gorgeous here in Texas. Other parts of the country, I hope you're enjoying it as well. But we do have the issue very strong in this area with allergies, and it not only carries over from the humans but also to the dogs as well. My dogs go out, they love to run in the big yard, and as you can see, they're little guys and they're low to the ground. And so when they come in and they've been sniffing around, their little eyes are watering, their nose is running, and so I grab the Kleenex and clean them up. But is this a common problem that you see coming in at this time of the year?
It certainly is, and it certainly manifests itself in a lot of different ways. Allergies are, if you think about it from a straight dermatology perspective, it's a big part of what we do on a day-to-day basis. So it's certainly extremely common, and there's a lot of different things that can be done to manage it. So, and that kind of raises an interesting point, because you say, okay, well, what can we do for allergies? Is that something that we can just manage, just like a lot of people will do? They take medications and they do something to specifically manage their allergies, rather than trying to figure out if there is a treatment, something to actually resolve it completely.
And do you think those allergies are spurred more by the grasses and the pollens? I've noticed in our neighborhood, it seems like allergies are more when people are out working in the yard and they're spraying the fertilizers and the pesticides and all of this stuff where the dogs come in. They kind of are having a hard time dealing with those as well.
Mm-hmm. Yeah, especially the types of allergies that we see on a seasonal basis, where there's a clear-cut timeline by which you start to get your allergies. I've got a couple weeks late in April where my eyes water, and it's really kind of a bad deal. Sometimes it's a little bit earlier in May. There's kind of a 3 to 4 week period where I'll have problems, and after that I'm okay. And with our pet patients, it's very much the same thing, in that a lot of dogs have a specific time where they will have their immune system will be more reactive than at other times in the year. And the interesting thing with that is that what we're starting to learn more and more about is that with the dog, there's actually a lot of times there's a greater food component than we ever thought. In other words, you can have a dog who you've got an allergy issue. Maybe there's some allergies in the off season, and maybe there's obviously things persist through the growing season, and we say, oh well, that must be a food allergy because that dog has it year round. Well, what we're now seeing is that there's actually a higher possibility that both those things are playing a role. Mm-hmm. And so a dog that very well has these seasonal allergies that have been pretty well understood for decades or forever, essentially, in veterinary medicine, are now starting to wonder, okay, how much of that is actually a food component? So.
And how can we tell if it's actual allergies?
Actual allergies compared to what, do you think?
To if they're having a reaction to, say for instance, something within their system that's going on. Maybe they've got an eye infection. Sure. Or whatever.
And the interesting with that is that so much of the time it's actually allergy related, which is why I put you on the spot there a little bit, because it is almost always, you think about ear issues, we think about conjunctivitis with the eyes, obviously skin issues, the effect that allergies plays on the body and the number of patients that it affects every year is huge. Mm-hmm. And so that's where we start to wonder, okay, what is this classic ear infection that we see? I see them in groups. They come in groups. I'll see 3, 4, 5 dogs, sometimes within a couple-day period, all with yeasty ear infections. Uh-huh. And I say, oh my goodness, what's going on? There's something pollinating that's obviously triggering those dogs. And some dogs, fortunately, they only have an issue with their ears. And obviously some of them have issues with the rest of their body. Sometimes it's their little bottoms, their anal sacs. Mm-hmm. At times it's a conjunctivitis that's allergy related. Now obviously there's a lot of other potential causes for allergy issue, or for eye related issue, but an allergic conjunctivitis is very high on that list. Mm-hmm. So, But that's kind of, I guess in my mind, I kind of default toward that being an inhalant atopic allergy, as they call it, before I start to consider other things.
So it's always best to take them in and have them checked.
It almost always
make
is.
sure
Yeah.
what's causing those problems with the little guys. I have one of my little guys who is very fond of apples. And so every morning when we're getting ready to feed everybody, we give our bites of apples. If I don't give him a bite of apple as fast as he thinks I should, then we start this slobbering and this drooling and this. Now that's not allergy related. That is just anxious to get that food. So there's different reasons why they could be having different effects like that. Well, we always try to be cautious about what we use around our animals. It could be a shampoo, a soap, anything like that that you're using. If you've changed a product and you notice that your pet's having problems, then you might try to go back and figure out what it is that you've changed. If you're using a laundry detergent or whatever that they could be allergic to, could be causing some skin problems as well. Are you getting in the conversation too? He says, I don't want to have any allergies.
I want nothing to do with that. So we might even talk a little bit about treatment of allergies, because that's just kind of clearly ties in. Once we've considered that it's a possibility, and it goes back to that concept about managing allergies versus not. We always try to manage them just like we do in people in order to get on top of that as best we can without having to go to some of the more invasive type diagnostic procedures. A lot of times I'll draw a kind of a progressional timeline for clients to help them understand that a lot of dogs kind of fall into the earlier parts where they can even be managed with some Benadryl, an over-the-counter antihistamine, and then the dogs, will progress all the way to the point where they potentially either need intradermal skin testing, where we actually shave a place on their body, usually on the side of their chest there, and give them a number of small injections just underneath the skin and find out what they're allergic to. And there's actually a lot of things in between. But probably some of the easiest things to think about from an early allergy standpoint for management, and we probably don't have time to go into some of those more extensive things, but early control, a lot of times we'll give a little bit of Benadryl. And for dogs, this, a smaller size, the dosing gets a little bit tricky, because just as a general rule, we give about 1 milligram per pound, and that's safe a couple times a day. So if you if you take a puppy dog that's 12 pounds, that's easy, because the liquid Benadryl comes in 12.5 milligrams per teaspoon.
Okay.
That's the liquid, the children's Benadryl. Whereas an adult tablet of 25 milligrams, if you've got a 25-pound dog, one of those twice a day makes plenty of sense. That's a pretty easy dosing.
Sure.
But using those guidelines, in other words, a 6-pound dog would get a half of a teaspoon of the liquid, which is only 2.5 mils. But the math gets a little confusing. But basically 1 milligram per pound. That's one thing that we a lot of times will start with, because it's over the counter. It's not very invasive. Antihistamines as a general class are a safe medication, and then we start progressing down the line. Another thing, before we run out of time, is fish oil supplementation. A lot of times with these guys, the omega-3 and the omega-6 fatty acids in their diet, whether it's added in a capsule form or specifically in a food that's enriched with those types of things, are very helpful in that the anti-inflammatory properties of those fatty acids are just tremendous. And the dermatologists, the veterinary dermatologists, are basically telling us that that's something that's dose dependent, to the point where you could give, if you wanted to give more than is even recommended, it's actually still quite safe. And in fact, it might even be doing a much better job. So. Okay.
Very good. Well, thank you very much for the information and the input, and hopefully this helps our little guys. And if you have an issue or a problem with that, please be sure and see your local vet as well. Thank you for joining us. Bye-bye.